Did you hear about the study with intravenous vitamin C and people with cancer? It was a study that shocked the medical community. In this video, I'm going to review the study that was done on patients with pancreatic cancer. As well, I'm going to talk about how to use intravenous vitamin C as an integrative treatment for people with cancer. And I'll get into the details as to how it can help people, their immune system, and those people who are fighting cancer. I'm Dr. Mark Stengler. I'm a naturopathic medical doctor, and I've been using integrative cancer therapies with patients for over 30 years. As well, I co-authored a book called Outside the Box Cancer Therapies with Dr. Paul Anderson. And in that book, we actually get into the details on intravenous vitamin C. But right now, I want you to get the information in this video. So let's talk about the study. The study was conducted at the Holden Comprehensive Cancer Center at the University of Iowa. And the study had 34 patients who had stage 4 pancreatic cancer, meaning the cancer had spread from the pancreas to other body parts. The overall survival rate for pancreatic cancer at 5 years is only 5%. All the participants received IV chemotherapy weekly for 3 weeks of a 4-week cycle, and this went on for several months. Also, participants were randomized to receive the same chemotherapy in addition to high-dose intravenous vitamin C, and in the study they used 75 grams 3 times weekly. And so, again, patients either got chemotherapy only or they got chemotherapy plus the high-dose intravenous vitamin C of 75 grams, which is 75,000 milligrams. So here are the results. Those who received chemotherapy and the intravenous vitamin C had an increased survival of 16 months compared to 8.3 months with the chemotherapy-only treatment. Also, those receiving the high-dose intravenous vitamin C did not have a negative impact on quality of life or increase the frequency or severity of adverse events. Patients receiving the intravenous vitamin C had a reduction in chemotherapy-related toxicity symptoms. For example, their white blood cells did not drop as low as those who are on chemotherapy only, and also their platelets did not drop as severely as those who got chemotherapy only. In addition, those receiving the intravenous vitamin C, and as you expect, had blood levels 500 times higher than those who were not getting the intravenous vitamin C. So while this study is very impressive because it shows that intravenous vitamin C obviously has benefit for people, it's not a cure. No one's claiming it is a cure. But look, when you have something serious like metastatic pancreatic cancer, meaning these patients had pancreatic cancer, which is very hard to treat in conventional medicine, it's also spread to other body parts, and you can double their lifespan, then obviously there's a therapeutic effect going on. So intravenous vitamin C is being taken more serious in the medical community. However, there have been many studies done in the past. Other studies have shown that patients who receive conventional treatment like radiation, chemotherapy, surgery, and also get intravenous vitamin C have longer length of life and they have better quality of life scores. So it is a shame that intravenous vitamin C isn't a regular part of oncology. Hopefully it will be. Right now it's integrative doctors like myself throughout the country and in different countries of the world who offer intravenous vitamin C to help these patients who are suffering from cancer improve their quality of life, give them a better chance to recover along with their conventional treatments. And so intravenous vitamin C has many different mechanisms. One of the mechanisms is it generates hydrogen peroxide in the cells, and hydrogen peroxide is toxic to cancer cells. Obviously, it supports the immune system. It does have effects on cancer-fighting genes as well, and it's anti-inflammatory. And remember, whenever you have a disease, especially cancer, there's definitely inflammation going on. So if you have cancer, I highly recommend you seek out a health professional who is trained in intravenous vitamin C. We can see that it's powerful, it's helpful. It can help improve your quality of life, length of life, and hopefully combined with other types of therapies, it can be a part of your overall program, an integrative protocol to help you to recover from cancer. Well, I hope you like this video, and you can see my YouTube channel for other videos on this subject.